I elected to have radiation therapy after a lumpectomy.
Samaritan Medical Center, it's a great name, Samaritan, because that's truly what it is.
I looked in the truck and all of a sudden I didn't see Shannon. So I ran to the side of the truck that she was on, opened the door. She was laying down trying to fall asleep.
I think I have a purpose because I should have died and I didn't. So that must mean that I have something really good to look forward in the future.
It wasn't even 10 minutes later. I mean, we'd expected her to walk in the door, and instead we get a phone call saying that, they'd been hit.
As he turned, he pulled right into my path. I did everything I could just to keep her awake, keep her there. I don't know, 5 minutes later, I look down the road and I see lights.
The force of the impact from the car hitting them was so great that it just snapped her. And it just caused the aorta to snap right in half. The surgeon came in, and that's when he took us out and told us what her condition was and how serious it was, and that basically he couldn't believe she was alive. They took her to surgery right then. I mean, there was no waiting after that. And then in the waiting room, every time the phone rang, we wanted to hear the phone ring and then didn't want to hear the phone ring. My husband answered the phone. I couldn't do it because I didn't want to hear what they had to say. And then he came out and said that she'd made it. So. There hasn't been a day since it happened that I don't think about it. Think about how your life can change in a second, how her life can change. It's devastating. I mean, you have a healthy, beautiful girl 1 minute, and then the next minute, everything. I mean, she's still beautiful, but she'll never be the same, ever.
I'm not on any medications. I feel great. I'm doing really well. So it's just things that I have to live with now.
My husband had been a patient there 7 years ago, and I was very impressed with the staff and the care that he received. I found out that I had cancer on June 13th. I knew the kind of treatment that my husband received at the center. I knew I didn't have to travel to Buffalo or Syracuse or someplace else to receive the kind of treatment that I thought I needed. So I was never afraid. And I'm not afraid now. I like the convenience of being home, being local. I could have my friends accompany me to my treatments. And I have one friend who comes with me every day. And I know they're medical people, but I consider them my friends, and that's the way they treat me. So I'm very comfortable when I come for treatment. It's almost like I'm not in a hospital atmosphere. You get accustomed to the daily routine. And it's just like coming to see old friends. They are my friends. I'm feeling wonderful. There is no difference. The treatment is wonderful. It doesn't make me sick. I am a little tired at times, but sometimes I'm such a busy lady, I don't know whether I'm tired from the treatment or from my social engagements.
Right now, Samaritan has approximately 40 different medical specialties, but each of these specialties requires certain equipment, certain technology, room to grow. We worked on this plan as a way to be able to expand our physician base, our number of specialties, recruit new physicians, keep our technology up to date, and basically provide the services to this entire region that are available now, and hopefully expand the services to new services that are not available. We work very hard to have a center we're proud of, a center that we'd send our own family members to. And having gone through this with my family and knowing how cold and confusing large centers can be in the big cities, I would treat my family here.
Through all our professions in this institution, we truly are committed to caring. I enjoy coming to work. I love my job and I love being here. The mission of this hospital, the commitment and caring that we give here. We can deliver, state-of-the-art big city care with a hometown touch. It's the balance of taking the emotional and the technical and weaving it into the true art of nursing. At the end of the day, feeling in your heart that you've made a difference, whether it be visible or invisible, just is a good day. I think celebrating life to me is a wonderful thing, and I truly enjoy that part of nursing.
Samaritan takes care of lots of babies, even those of us who were born a little too early. At birth, I weighed 3 pounds 6 ounces.
1 pound 12 ounces. 1 pound 14 ounces.
1 pound 13 ounces.
1 pound 9 ounces.
3 pounds. 1 pound 10 ounces.
5 pounds 3 ounces and still growing.
In fact, our entire community is growing. That is why Samaritan is embarking upon this capital expansion and renovation project to meet the growing needs of Jefferson County and the community that we serve. The project itself consists of a new and expanded emergency department, as well as consolidated operating rooms, which will allow us to use the latest and accommodate the technology that we have here at Samaritan. In addition to that, we have new intensive care units, progressive care units, and we also have one new medical surgical floor that will have all private rooms. We often talk about this project, the bricks and the mortar, but it's really more than that. It's all about the staff and the services and what we provide to this community. And I'm just so proud to be a part of this organization, to work side by side with a great group of professionals, the physicians, the staff, the volunteers. It's really all about our employees serving this community, and they do it in a fantastic way. It's just a great group that work here at Samaritan.
This project, more than anything, gives this whole community this wonderful sense of hope and of a future. You think you live in a little town up in the middle of northern New York, and yet you are going to create this absolutely beautiful medical center that's going to say to everybody else, look what's happening here.
And I think also that the community recognizes that a strong hospital and a vibrant hospital is essential to living in the North Country and in this area.
Without community participation, the hospital would just be a shell. It wouldn't have any of the vitality or just the sense of caring that you find here right now.
The enthusiasm is there, and the community knows that it's a great, wonderful project to be part of.
Every dollar that comes into this campaign makes a stronger hospital 50 years from now. Every dollar that the hospital doesn't have to borrow to complete this project means that our underpinnings for the next 100 years will be that much stronger and deeper.
Well, that day it began wonderfully. And about 4 o'clock that day, I was at my desk just doing bookwork, follow-up on that sale and other things. I felt this ache in my right arm, like a bad toothache. I said, this can't be a heart attack because it's not the left arm. And there's no sweating and no tightness of the chest. At 63 years old, I was scared. I really was.
Okay, we're at the hospital. We're going to get you out now.
When I reached that emergency room inside, there were a team of people waiting for me. And that's when I began to be relieved. That's when I felt okay. That's when I felt secure, and I felt an embracing of people just reaching out without even touching me. If it weren't for that staff and that doctor at Samaritan Medical Center, I still don't know what would have happened. I knew that I had to be here. It was very important, and this is where I wanted to be. That was an eventful day, to say the least, but I was in denial. Then it turned out all right, you know. Well, you know, it's funny, a turn of events, you have something critical that happens to you, and it seemed like this was an order that happened of something great to happen right after that. And we were blessed with a beautiful granddaughter, my first grandchild, my daughter's first child. Her name is Nicolette Rose. And I said, gee, the last time I was here was in the emergency room. You know, this is great. This is a wonderful feeling. It's just, I looked at her and I said, Grandpa loves you. Grandpa's happy today. You know, you were meant to be, you're a treasure of the world. You know, it's just a great feeling. You know, I swear she looked back at me and said, hi, Grandpa. I'm glad you're okay. I'm Ron Malara, and I'm a heart attack survivor.
My name is Barbara Weber. I am a cancer survivor.
I'm Shannon Hogan, and I am a trauma survivor.
It's about the expertise and compassion of our staff, the expanded facilities, and the support of the community that will allow us to advance healthcare close to home so that we can have more happy endings like the ones that we've shared today.